Hello, everyone. Welcome to another snippet on what pharmacists do. Today, we are going to talk about the mother specialties of all pharmacy specialties, and that's community pharmacy. And to do that, I have with me today an old friend and schoolmate, Dr. Elmira Shirazi. Dr. Elmira graduated from Touro University, California, College of Pharmacy, class of 2015. And since then, you've been working at Walgreens as a pharmacist. You've been doing such an amazing job. You were recognized with a couple awards. The first one I want to mention is the Pharmacist of the Week award from Pharmacy News Today. And more recently, Walgreens dubbed you Champion of Champions, and you received the Champion of Champion award. So Elmira is amazing at what she does at serving patients, and I'm honored to have you here today to shed the light on what it is that a pharmacist does in the community setting. Welcome, Elmira.
Bridget, thank you so much for having me. It's an honor to be here. And if you ask me, I totally see you as a champion.
Thank you, thank you, thank you,
Welcome.
thank you.
So you
Yes.
had
So tell us about this Champion of Champion awards. What did it entail?
so the Champion of Champion Award is a recognition I was nominated for by my district and my pharmacy manager for having passion for what I do, for being dedicated to the field of pharmacy,
Mhm.
for not just going to work to go to work with a positive mindset, a positive attitude, walking in happy, having fun with my staff, being there for the public, providing my services with care, compassion, and empathy,
Yes.
and always willing to help out wherever help was needed, regardless of how last minute I was notified to show up for a shift or how long it took to get to my destination. And I've always been in this mindset ever since I graduated back in 2015, and I truly love and enjoy what I do, and I'm very passionate about being a pharmacist in the community setting.
Yes, yes, yes. I'm sure your patients are blessed to have you. So the Champion of Champion Ming Award really was recognizing you for always being there for your patients, no matter how far, no matter what time, being there for your staff, for your company, and just like you said, loving what you do. Because when you love what you do,
You'll go above and beyond.
go above and beyond. Yes.
Exactly.
So before we dive more into what you do as a pharmacist with Walgreens, I'm curious to know, what do you like most about a pharmacist? And then you can tell us about what a pharmacist does in at Walgreens and in the community setting.
Okay. What I'm the most passionate about and what I enjoy the most every day
Mhm.
is knowing that within the healthcare field, community pharmacists are the only healthcare professionals that are readily available and accessible to the public.
Amen
We're
to that. Yes.
we are right there in every corner of the streets. We're right there in the consultation window, always ready to answer questions people have about medical conditions, about new symptoms they're experiencing. And we are trained to help people either to help people relieve these symptoms or triage them and refer them appropriately to seek further help for whatever it is they're experiencing, whether if it's a headache or a burn, a
Heart attack.
heart attack, exactly, or
Anything.
an
Yeah.
infection, all kinds of medically related questions. And honestly, I feel so honored to know that within the healthcare field, community pharmacists are so readily available. People don't need to make
Absolutely.
an appointment to see us. They can just walk in and we're right there, eager to help, and totally willing to share our medical knowledge
Yeah.
with people to help them seek the appropriate care and also assure them that everything will be okay.
Yes, absolutely. Absolutely. So, yeah, that was great. That was great. Um, so, what do you do? What kind of services do you provide for your patients?
So, in the community setting, a pharmacist provides a number of services from consultation on new medications, side effects, new side effects or existing side effects, resolving drug-drug interactions, um, communicating with doctors, nurses, physician assistants, all kinds of other healthcare providers in coming up with the best and the most appropriate treatment regimen for a patient based on underlying medical conditions or history of other illnesses or drug allergies, and so
Yeah,
much more.
yeah, yeah.
And some of the most newer services that pharmacists are known for, or people may not even be aware of until they watch this video, is we are now able to prescribe birth control pills. We
Yeah,
prescribe Narcan now. Narcan is a nasal spray that reverses the toxic effects of opioid pain medications, and
yeah.
this is really important
It's a
to
huge issue these days. Yeah.
exactly. The opioid addiction is on a rise, and it's a huge issue. And we also are able to assist patients in smoking cessation.
Mm-hmm,
We have a
mm-hmm.
number of smoking cessation products available over the counter. And honestly, on a weekly basis, I help patients with making the right decision on which products to use for smoking cessation or even over the counter medications.
Yes, yes,
Also, ever since the COVID-19 pandemic broke out,
yes,
exactly
yes,
what I see that pharmacists are being recognized for
yes,
is
yes.
immunizers. We are immunizers. We have been providing the vaccines and vaccinating people for the past, I would say, it's been 6 months now.
Yeah, yeah.
Yeah, it's been 6 months.
Longer. I'm thinking even longer, right?
Exactly.
Mhm.
So now the community sees us as immunizers, and every day I have people either calling me at the pharmacy or showing up to the pharmacy wanting to gain more information about these vaccines and which
Yes,
ones they should get.
yes.
And they trust us. They believe in us,
Mm-hmm, mm-hmm, mm-hmm.
and also COVID testing.
Yes.
We do
Mm-hmm,
COVID testing now.
mm-hmm,
We do
mm-hmm.
COVID testing.
Yeah.
So these are some of the newer
Services.
services
Yeah.
that people have recognized us for ever
Mhm.
since the COVID-19 pandemic broke out.
And speaking of immunizations, not just COVID immunizations, right? We do flu, pneumonia,
Whooping
shingles,
cough, whooping cough.
think of
In
traveling. If
exactly.
someone needs to travel, they can totally get their vaccines with you at Walgreens and get
Mhm.
their immunization record and all of that from you. There's so
Exactly.
much that that the community pharmacy does to serve the public and to serve patients.
Exactly.
Yeah, yeah, yeah. Um, so to summarize, pharmacists, community pharmacists more specifically, are the most accessible healthcare providers out there. I mean, no appointments needed, no calling the advice nurse first. Patients can just walk in. More accessible than doctors, more accessible than nurses, respiratory therapists, dentists. And we can answer questions related to any of that. You serve kind of as the triage. You know how when you go to the emergency room, they triage and say, you go here, you go there, you go home, you get admitted and all that. You are able to look at a patient's rash and you were trained to determine is it something that can be taken care of by the patient at home, and you can recommend remedies for these patients. But you can also say, oh, that doesn't look too good, I would go to the emergency room. Or you can say, for now, apply this cream, it's right there, and tomorrow or in 2 days, if it's not better, go to the doctor. So the most accessible uh, healthcare provider, and you make sure that when the patient brings his prescription, whether it's from the doctor, the primary care doctor, or the emergency room, you don't just give the patient what's on the order. You make sure that it's safe and appropriate for the patient. You check for allergies, drug interactions, and much more, right?
Mhm.
And patients can bring their children and get their flu shot, their COVID vaccines. If they're traveling, if they need, you mentioned Narcan and birth control, blood
Mhm.
pressure screening, diabetes
Exactly.
screening, so much more that I wish
And
every patient
Bridget,
knew they could access from you.
what is most rewarding is that people actually really trust us. I've had experiences where a brand new patient that is not a regular to my pharmacy comes into the
Hmm.
pharmacy and asks me for, recommendation on what they should do. For
Yeah.
example, one patient was experiencing a lot of pain on the ribs, and I told him that it could potentially be shingles breaking out, and it was. And I referred him to the doctor. I said, get it checked out. You would probably need some antivirals to start right away.
Hmm.
And sure enough, the patient came back to me a week later, and he was so thankful for my recommendation, and he saw the doctor. It was a shingles rash. He was started on the appropriate medication for it. Also, I've had brand new parents for the first time come to the pharmacy for
Hmm.
all kinds of medically related questions about their infant and children,
Yeah.
pain, fever, diaper rash, mosquito bite,
Yeah.
and people trust us. They trust
Absolutely.
us and they
Absolutely.
accept our recommendations. I
Yes,
have so
they do.
many beautiful stories
Yeah.
about
Yeah.
that.
I,
And
I know. I
so
know.
many times I've had patients come to the pharmacy, drop off a prescription, and the role of a pharmacist is not just to fill a prescription,
Uh-huh.
do a
Hmm.
thorough screening. So many times I've had patients come to me and they're allergic to a specific medication,
Hmm.
and they are being prescribed that medication. And if they took it, it could be really life threatening. And
Yeah.
so that's where I come in and I intervene and
Hmm.
I speak to the patient and the doctor and to change the therapy. So we do so much more than just filling prescriptions. And
Absolutely.
you know just a lot of the times I feel like people think that we just fill prescriptions, and we do so much more. Like you mentioned, diabetes screening, diabetes education, over the counter product education. We're just there to share our knowledge on a daily basis.
We do everything in the community pharmacy. I mean, everything. Am I lying?
No, no.
No, patients can literally ask us anything, show us anything, and and we know where to guide them, where to steer
Exactly.
in the right direction.
Exactly.
Elmira, Walgreens is blessed to have you for the past 5 years and now and going forward. And I'm blessed to have you. We are blessed to have you here today with us, share your expertise and your knowledge. And
Thank you.
thank you so much. I'm looking forward to having you on other episodes to dive deeper into the role of a pharmacist out there in the community. Until then, have a great week. Have a
Thank
good week,
you.
everyone. Thank you for tuning in and listening. God bless you.
Thank
Until
you.
next time.
Bye bye.